A cataract is an eye disease in which the lens loses its transparency, leading to a decline in visual acuity. This process may occur gradually and impair both near and distance vision. Cataracts most often develop with age, but may also result from other factors such as trauma, prolonged use of certain medications, or systemic diseases, for example, diabetes. Phacoemulsification is a modern surgical method for treating cataracts. Phacoemulsification proceeds in several stages. First, local anesthesia is administered, which may involve installation of anesthetic, eye drops, or a subconjunctival injection. Afterward, corneal incisions are made to gain access to the lens. A mydriatic is gradually introduced into the anterior chamber to dilate the pupil. Trypan blue is applied for improved visualization of the lens capsule, and a viscoelastic agent is injected to maintain the anterior chamber depth and protect the cornea. The next stage is the creation of a continuous curvilinear capsulorhexis with a diameter of 5.5 to 6 mm using forceps. Hydrodissection and hydrodelineation of the lens nucleus are then performed to improve its mobility. Using a handpiece, an ultrasonic tip is inserted through the corneal tunnel incision into the anterior chamber for phacoemulsification. Through a paracentesis, a chopper, an instrument used to split the nucleus, is introduced into the anterior chamber. Phacofragmentation of the lens is carried out endocapsularly using the groove technique. In the next stage, the chopper is used to rotate the divided nucleus by 90 degrees, and the chop technique is used to further divide the nuclear fragments. Then, in aspiration mode, each lens fragment is sequentially engaged with the tip of the phaco needle and brought to the center of the capsulorhexis plane, where it is emulsified ultrasonically, with larger fragments divided as needed. A posterior chamber elastic intraocular lens is implanted using a cartridge pre-filled with viscoelastic. The soft elastic intraocular lens is then loaded into the cartridge. At this stage, the capsular bag is filled with viscoelastic. The intraocular lens is implanted through the tunnel incision. After implantation, it is centered within the capsular bag under visual control. Before the final stage of the surgery, to prevent secondary hypertension in the early postoperative period, the viscoelastic is removed using an irrigation aspiration system. The final stage of the procedure is hydration of the paracentesis edges to ensure complete sealing.